forum about weather. Vermont's made the decision to go ahead with an exciting new healthcare vision. And so we ask you to sort of leave the weather at the door, because this is a really exciting chance for you to sit down, engage with others, engage with us, and really we can roll up our sleeves and we can talk about how. So the legislature actually asked us to undertake this even before we started putting together a finance plan. Your input tonight will have an immediate effect because we are making a report to the legislature in February, and we're going to inform them what we learned at these sessions. So it'll have an immediate effect, and of course it will have a very important long-term effect.
Between 1992 and 2009, the spending on healthcare for Vermonters tripled. We spent $2.5 billion in healthcare 10 years ago. We spend about $5 billion now. So that's a $2.5 billion increase, a 50% increase in just a short couple of years. We'll spend an additional $1.6 billion per year in just 4 years if we don't reform our healthcare system. That's almost $12,000 additional per person, per family of 4, for every family in Vermont. So the cost is significant. It's growing fast. And unfortunately, what we continue to see is that there are a lot of Vermonters who still aren't covered, and a lot of people who are really getting less for the dollars that they're spending. So we still have 47,000 Vermonters who are uninsured, which means that they have no coverage at this point. It's always important to point out that if they were to get into an accident, if they were to get really sick, if they were to get seriously injured, they're going to go to the hospital, they're going to get service. It becomes very complicated about how that gets paid for. But at this point, they have no insurance coverage card in their wallet to avail themselves of. We also have 150,000 Vermonters who, while they have an insurance card in their wallet, they do have some coverage. They face financial risk if they were to get sick or injured in taking that card out to use it because of the cost in copays or deductibles of actually accessing the coverage that they have. So more and more Vermonters, even though they're paying more and more, really have a difficult time accessing the coverage that they have because of the growing out-of-pocket expenses that many individuals have to pay. The overall cost continues to squeeze Vermonters, both as individuals and families, as well as employers and businesses. Between 1996 and 2006, the average annual premium, often paid either by an individual or partly by an individual and partly by an employer, has nearly doubled. So again, for the same basic coverage, people are paying twice as much in premiums in 2006 as they did in 1996. Healthcare costs are rising, and on average, while Vermonters are making, many Vermonters, and on average Vermonters are making the same amount in their income, they're paying double in premiums with the same income that they had several years ago. So incomes in Vermont have not kept up with the growing cost of healthcare that many people are having to pay. So what does that mean? That means that in many cases people are giving up wage increases at work because any increase in their total compensation is going to pay for their premium, not to go into their paycheck. We see employers who make the choice that they can't add employees because whenever they add an employee, they're going to have to add a healthcare premium to their expenses. We see a lot of people not taking the risk to start a business, to not going into a new venture because they don't know what's going to happen, how they're going to cover their health insurance costs along the way. And so what we see is a reduced value for the dollar that people are spending, and that is getting significantly away, not just in the health and well-being of Vermonters, but into the basic economic fabric of our state. Doctors also are getting squeezed. Right now, what we we tend to see is that doctors are paid by the volume of the services that they provide, not necessarily the value or the outcomes of the services that they provide. So in order to make more, they have to do more, which drives costs in our system. And for those who pay for health insurance, so my department pays for those who are on Medicaid, Blue Cross Blue Shield, NBC pay for those who are on private insurance. One of the basic ways that we have to control cost, if we don't perform our system and do things in a different way, is to squeeze providers and how much they get reimbursed. So as we continue to struggle with the rising cost of health care generally, it's not just affecting individuals, it's not just affecting employers, it's also affecting those who provide the care to Vermonters throughout our state. We have the problem that we ask providers to produce more and more paperwork, more and more time going into just trying to figure out how to get paid in terms of the paperwork, the complexity, and all the things that we require people to do. So all of that money is going into making healthcare more expensive and diverting money away from having people get the care they need just to fuel a system that's more and more complex. Healthcare reform isn't just a problem, it's also an opportunity. And it's important for us to focus on this part as well. If we were to implement a new system for financing and providing and delivering and paying for healthcare, we could cover everybody. We could improve the coverage for those who are underinsured and continue to save money in our system compared to what we're doing today. If we were to save money that we were now spending on healthcare, our state could invest those in other things. Those could be health-related things like helping to keep people healthier and safer and make our communities more supportive of healthy lifestyles, or it could be investing that in other efforts to improve our state, to create jobs, to improve our economy. So we have significant opportunity to reform our system. We have significant opportunity to help people be healthier, and we have significant opportunity to improve the environment of our both families and our businesses and our economic climate if we are to take advantage of the opportunity that healthcare presents. That's what drove us to want to do healthcare reform on a broad level, and what brings us back here tonight to try to figure out, as Vermonters, how do we move forward in a way that takes advantage of the opportunity of healthcare and helps us minimize some of the problems that we're seeing in our current system.